All right, the next in our greatest hits collection is my interview with Ed Marx from April 2021. He shared how marketing and culture can either be catalysts for digital change or prevent progress from happening, and how healthcare martech stacks are often a glut of point solutions Frankensteined together. Ed is a luminary in our industry, and his remarks are just as relevant today, so let us know what you think.
The flow.
My goodness, listeners, I can barely believe this, the opportunity we have to have Ed Marx on the program today. Ed's in the house with us. Ed's the Chief Digital Officer at Tech Mahindra. And prior to that, my goodness, where do we start? He's been blessed to be the CIO in a lot of progressive organizations, everyone from Cleveland Clinic to Texas Health Resources, New York City Health and Hospitals, University Hospitals in Cleveland, I believe. So, Ed, how the heck are you doing?
I'm great, Jared. I feel really privileged to be part of the wrap. In fact, I thought I might have to put together my own healthcare wrap as part of my introduction, but I'm doing really well. Thank you for having me. And yeah, all of what you just said is really just a testimony of great teams and organizations that I've been fortunate to serve with.
Well, I think that's something that resonates. And I was going to get even to the part to mention the several books you've written, and not even just all on healthcare, but the latest one happens to be Healthcare Digital Transformation. It's the roadmap, people. It is, anyone who's been listening to this program, especially for the last few months, knows I've almost turned it into a book club. I've been reading excerpts from it. People are probably like, okay, Jared, you didn't write the book like Ed did. So it's been a lot of fun just to give people a lot to think about. I imagine the reception of the book has been a lot of fun. Hopefully you've been getting some really good reaction to that, I imagine.
Yeah, the book has done really, really well. We were fortunate in terms of the timing. The pandemic is unfortunate, no doubt about it. But we were ready to launch around the time that the pandemic became more and more real, maybe February of 2020. And so we were able to stop before it went to production. And then we rewrote it, bringing in to the fabric of it, not just COVID, but pandemic for the future. So we think of it as a pandemic proof book. So hopefully it'll last the test of time.
Yeah, that was really cool. It was so timely, that portion of it, to be able to actually wrap it in and to say, here's what organizations have been doing. And that makes sense for these parts in the future. So that had to be really cool. Oh, cool. So let's break the ice here a little bit in terms of the latest awesome thing you've come across in life. What do you have for us today, Ed?
Yeah, so this is really clever. And I have to be transparent and say that the reason I know about it is because I get to work with some of the fantastic people that created this out of an agency called Born, B-O-R-N. But they do like 25% of the Fortune 1000 sort of websites, the commerce, the content, the creative aspect. So it's kind of fun to work with these people. And they redesigned the Oreo cookie website. And so my family, full of vegans, Oreo is about like the only tasty thing for these vegans. They've forced me to be vegan with them. And so you can go on there and personalize your Oreo cookie. Like literally you can upload your photo into them. You can determine if it's half fudge, half wafer, a double stuff, triple stuff, whatever you want. You can create an Oreo for yourself. And the same individuals also did Purina. So talk about dog food. And, if you want to buy a bunch of dog food, you normally have to buy the same thing. Like if you get a package of 24 of some type of dog food, it's all the same, right? It's all puppy, chow, grain free. But you can personalize it on the Purina website to where you want 10 of grain free and 10 of tuna. And so you make your own packaging. So this hyper personalization, Jared, I think about, oh my gosh, that's what we need in healthcare. So those are some cool websites I've come across and used, and it's pretty cool.
I will be checking that out as soon as we're off the line. I love hearing about stuff like that, especially on the Oreo side. Yeah, that'll be a treat in this house. That will be happening. I can promise that. So awesome. We were mentioning in kind of our pre-show here that I feel like I could go 800 different directions here. The couple of places I think I want to focus with you in our brief time have to do with where marketing and culture fit in with digital transformation for healthcare organizations. And I think it's safe to say that you are, above all things, you're an advocate for making progress with the digital transformation in healthcare and helping organizations understand what it is, what they need to do, and how to do it. And we do talk a lot about, because it's so involved with digital tech, we focus on the IT side first, which I think makes sense. Nothing matters if we can't get that part. And then there's this marketing side that has kind of come up in between. There's the traditional marketing and communications, advertising, engagement. But then there were all these over the last decade, maybe 10, 12, 15 years. You first had a website out there, then you added social media, then you added all these other point solutions that are creating engagement with patients and with consumers. And if we're not careful, we just have this glut of them, of these point solutions, and they're kind of Frankensteined together, and we're calling that a digital experience for patients. So talk to us about kind of where we are right now from the marketing portion of digital transformation.
Yeah, so I always believe that you have to make marketing your best friend. And I like to think of it like, I'm really into music like you are, Jared, and I think about the success of the Beatles was largely the writing of Lennon and McCartney. So I think about, the relationship between marketing and IT or digital leader needs to be like Lennon and McCartney before Yoko showed up, So it's really got to be tight. Like, sometimes you might write the lyric and I write the music, and other times we collaborate on both or one or the other, but we bring it together and it makes this beautiful, beautiful music. And that's the only way to make it work, because when it's IT driven, or, I represent sort of chief digital officers as well, a little bit of offshoot of IT or completely different, depending how you look at it. But in order for that to work, no matter how great your plans are, if you don't have marketing at your side, I think it's going to fail. And I think it's the same with marketing, where if you can be a great marketer and be beyond sort of that, the old content marketing type brochureware. But if you don't have the ally in the tech side, digital transformation, it'll only be half baked. So that relationship is really important. I've been fortunate. One of my friends who I served with at Texas Health named Paul, and then at the Cleveland Clinic, I served with another Paul. Those two were my buddies when it came to digital transformation or trying to move the organization forward. And even in New York City, there was my friend Joe, and he's literally one of the first people I connected with, because we were implementing huge digital transformation in New York City. And we knew the only way we would be successful is really to tackle culture, and marketing is so critical, because that's not only marketing the brand of the actual digital transformation that you're doing, but it's all the in-house internal communication. So it bridges both the internal and external. And it's really critical that they are as forward thinking as you and vice versa. So it's got to be an equal peer, like Lennon and McCartney. They both brought strengths, but they were peers. And that's the way it needs to be between marketing and IT. And that really impacts the culture.
For sure. That's a great example. As I kind of lean into that, the thought of any very successful songwriting duo or team, they created things together that they could not have created on their own.
Yes.
And so that's sum of the parts is something that if we don't approach marketing and IT in the same way, we're not going to get that same beautiful music that's right. Coming out of that relationship. I imagine that some of that success, I imagine you just mentioned some of those colleagues you were fortunate to work with, but I imagine it wasn't just the only thing that made that successful. Both sides still had to put something into that relationship culture-wise to make that work. Talk us through that. Like how did you approach things to get to a point where you were speaking the same language?
Yeah, I think it requires a lot of humility. I always say leadership is humility. So you have to go in and be a really good listener and don't believe that you have all the right answers. So yeah, I had some great experiences because I was with some great teams and organizations, but that doesn't mean that it was going to work in that particular culture that I was coming into. So like if we get really, down to earth, like with Cleveland Clinic, that was a completely different culture than New York City or even Texas Health. So you really had to be respectful of the culture, but not necessarily become assimilated into the culture. So what do I mean? So when I first showed up at the Cleveland Clinic, I met with Paul, and he was just a couple doors down, which made it very, very convenient. And I just soaked up everything I could from where he was headed with the organization from a marketing and branding point of view, what he thought about technology, how he thought it would work best. And I just listened. And even though I necessarily didn't agree with everything, I certainly was in major listening mode and developing a relationship. So I know, Jared, this may not be the exact, sort of answers that you think you might hear from me, but it really came down to humility and then developing a relationship. So I always spend more time on the relationship side and the listening side, because it pays dividends, because then you build that relationship and you build trust. And then you can bring to the table some of your ideas on digital transformation. So an example would be CRM. So we realized we didn't really know who our customers were, and we knew we needed a CRM system. And we had about 5 different divisions, each going after their own CRM, and each were adamant, about their CRM. But Paul and I, we developed this relationship, and we really came to respect one another. And even though he wanted to go down a certain road with CRM, he realized, you know what? We should probably do something together. It's not good for the organization to do something differently. So he was really listening to me as well. And we made a decision, that worked for the benefit of the entire organization. So we became pretty much hand in glove, and we started talking to each other and giving each other heads up about certain things coming down the road that we didn't want the other to be surprised about. And that really helped change the culture, making it much more collaborative, making it much more enjoyable, and at the end of the day, much more successful for our patients. And, I could go on and on about the marketing there. It's not just there. It was at the other places where I served as well. It's really about that humility, developing the relationship, listening, and then not always having to be right. So even if you thought that something should be a certain font, I'm just being silly here for the sake of example. I wanted Times Roman, but you wanted something different, but Times Roman was really the best one. I would just give it up because it's not worth it, right? It's not worth the relationship. I'd rather lose that smaller battle in order to get the bigger victory for the organization. So it's things like that really helped, change the culture, make a difference. Let me say one more point, because, we were talking about successful songwriting duos. You also have to be competent. So you just can't come up with ideas that are out of the blue and not well thought through. And so you have to be able to be competent and ensure that your team is the same. And so that was also important, is establish credibility by not only being a good listener and being humble, but being competent as well, and showing that you could execute on plans and you could help or be part of developing strategy. And so it became to the point that I think that in many of these organizations that marketing could have been speaking, and you might have thought you were speaking to IT. And I think I was a pretty good brand ambassador on behalf of marketing. So I think it worked well both ways when it's done right.
Well, that's a great way when we think about opportunities to innovate here, because there are most certainly plenty of healthcare organizations still in that spot where they're trying to figure out, where do they meet? Where do they find some common ground? And they're looking at least asking the questions, what are those shared goals between all of us? At the end of the day, we're all saying we want the same things. Yeah, of course we know our customers. Of course we understand what they want from us. And we're still going to, not change our strategy much because we know. And right. I think the number of platforms that are out there kind of throws a wrench in that. It's not that simple anymore. There are dozens of platforms, maybe even hundreds by the time you add up all the applications between IT and even just the marketing side nowadays. We've created all these silos of expertise, and now we're trying to kind of Frankenstein that all together and say, yeah, we're really spot on. We know our consumer experience from that. I'm thinking in terms of even figuring out what should those shared goals be between these departments. Where do you go to first and foremost? Where do you think about what types of goals can be shared between these teams?
Yeah, so I state the obvious, and you just use your own words. And the words that I always have used is, look, we want to move our organization from pockets of brilliance to an enterprise of excellence. So yeah, we do some great things here and there, but it's not even. It's not all the way across. I won't name the organization, but we were known for, really good certain type of virtual care. But the rest of the technology stack or breadth of services was horrible. The customer service was terrible. And it's I don't want a couple of great, bright, shiny things that people point to and say how great we are, when we know, in fact, we really aren't. So we need to move to an enterprise of excellence. And so the only way you can do it, going back to sort of the partnership, is by working closely with your peers and the entire organization. And so, yeah, what are the shared goals? What are we trying to accomplish? And it has to get down I believe the more granular, the more clarity you can bring, the more focus, I think the more success. So again, I won't name the organization, but I belong to one where there was probably 4 or 5 different members of the C-suite who felt they owned patient experience. So, right, that's the latest buzzword. Everyone's about patient experience, as we should be. And everyone felt that they owned it. The CFO felt that they owned it because patients interact with, a front desk, especially pre-COVID. And, billing is a big part, registration. They felt they owned patient experience. And in fact, when I was putting together the digital strategy for the organization, I found out through, secondary means that they had brought in consultants to do patient experience on their own. And then you have, patient experience department, perhaps, that has their own vision and idea. And then you have perhaps the medical staff and operations. And literally in many organizations, I think if you were to ask who's the leader of digital, you would get a lot of different answers. So it's hard to get clarity. It goes back to what you were saying earlier, Jared, about, 1,000 different things going on and none of it really coordinated. So someone has to take the lead and, working in a collaborative fashion, put together a strategy that's aligned with the organization strategy, but at a level of depth that there is that clarity. So no one can go off and, to left field, and claim that they didn't know any better. So it's an art form again, it goes back to developing the relationships, including everyone, giving up some things that might be important to you for the greater good, and then coming out with a plan that everyone around the table has to agree with. And in fact, that's what we did. A couple of the organizations where I served, it was a hard process to go through and get through. But once we had that level of clarity, it made things much easier. It wasn't perfect by any means. People still want to do their own thing, but it's very helpful to get everyone on the same page, include them in part of the process of developing those goals, and then having shared, we call them OKRs, objectives and key results. Some people might call them KPIs, key performance indicators, but having shared ones. So the only way that I could double the number of lives touched was to work with marketing. So that was one of our OKRs, double the number of lives touched. So if, as an example, making up the number here for sake of simplicity, if we reached 1 million patients a year, we needed to reach 2 million patients in the next 3 years. So that's double the number of lives touched. If I think of it from the purview of a chief digital officer or chief information officer, it's going to fail. I'm not going to get there. And if I think about it from a COO perspective, well, I can build twice as many hospitals. Is that how I do it? Or if I think about it from a marketing perspective, I need my SEO, capabilities enhanced. I need to work on a new branding campaign. No, it's all going to fail. We'll never reach that. But when marketing and I have that together, double the number of lives touched, you bet we start thinking about virtual, and let's invest more in branding around virtual care capabilities and so forth. So that hopefully is a practical example of how it would work, including everyone in the development of a plan, coming up with KPIs or OKRs, measurable goals that you're both responsible for achieving. You can't achieve it without the other. That's when you see culture shift and change. And it benefits at the end of the day. And Jared, I know you feel the same. What we do is really to serve others. And we're there to serve our communities and help save people's lives and increase the quality of care and patient safety. And that's how you do it, by these type of relationships, and specifically marketing and tech working closely together.
Yeah. And I think especially right now, we're at this precipice, we're at this opportunity to take what we've learned from the pandemic and say, the genie's out of the bottle, with opportunities to really create, new hybrid care models that aren't fully virtual and aren't fully in person, that we're kind of the dawn of this new age, if you will. It's at least the opportunity. I don't know how it's going to go. I don't know how fully baked this is going to get, but I see what can happen. And that gets me really fired up here, because that's what we've been talking about in digital health circles for, a decade plus, probably much longer than that. But, we got a better idea over the last 10 or 12 years of what could be. And I see that opportunity for someone like a marketing team. I remember feeling that it was very important to go into any meeting with any representation from an IT team, being able to speak the same language and have a level. I'm glad you zeroed in on the competence part, because I'd see people go into these meetings and they're intentionally, like, they weren't even trying to understand what was being said, and there'd be data up on a screen and people wouldn't even, they would just be like, that's not my thing. And I'm like, well, I want that to be my thing. Like, I want to understand what that is. And I need to be able to speak with a level of competence, or these guys are just going to like roll their eyes at me. And then the last thing they're going to do is talk to me about a shared goal. So, right. They're the kind of like, hey, what do I bring to the table in these smaller encounters, so that we can kind of build up some goodwill and some recognition that there are some things for us to do together. So I'm glad you zeroed in on that part.
Yeah. And the other technique as well that I did is partnering externally as well. When we talk about innovation, so we talked about some examples, internally, alignment, culture. And I work closely with marketing. We had a relationship with a big tech firm like Google. And so rather than marketing having its own kind of deals going with Google, and then us from a tech point of view, we had our own sort of things going, and probably somewhere else in the organization had the same. In fact, they did, in maybe the research organization or something, is working together and bringing together all of our collective IP, our collective spend, and really trying to disrupt and advance digital transformation by working with a partner. And because, sometimes it's too big of a thing to change on your own within your organization, depending on how big your goals are and your vision. So it's worthwhile too to work with partners or bring in outside counsel to help you think through some of these things. So I'm big into partnership all the way around, internally, externally. But again, it does take a layer of humility to say, I can't figure it out on my own. I could, but it's probably suboptimal. So let me hear from other experts that have done this in other organizations, or seen many organizations, both in and outside of healthcare, and bringing best practices to bear.
Yeah, for sure. It's one of those things that should go unsaid, but we have to keep that in the forefront. We just have to keep putting these things up in front of everybody to remind them why it's important. And especially when everyone more are working from home than ever right now, including right. At health systems. I mean, on these support teams, we have a lot more working from home. What other opportunities for innovation are you seeing from those you're speaking with or working with or thinking back? What other opportunities should we be looking at right now when it comes to digital transformation?
Yeah, I think experience, people are talking about that. Everyone's talking about that now, just like digital transformation, and really talking about this new kind of patient and experience. And I talk about it both from a patient, a family experience, as well as a clinician experience. So experience in general, and that's how I sort of define digital transformation on my own. There's no perfect definition. And I always tell people, whatever works for you, in your organization, that's the right definition. For me, it's really wrapped around the word experienced, powered by tech, enabled by design. And I think we're missing a design element. So we talk about experience, which is good. So it's on everyone's agenda at the executive team meetings, but we still look at it from either a tech point of view exclusively, or we look at it, again, if I'm the CFO, through a finance lens, but we're not really looking at it through human-centered design. Or as my friend, Dr. White from WebMD, he talks about patient centricity. And so I think that's sort of what's missing. It's like there's some vendors, and I won't name names, but they're engineering focused. It's all about the engineering, again, going back to technology. And we really need to take a step back and just get more practical. And it's like, hey, what's the design? And what I mean by that is things like workflow. Does that really work in reality? And how do we make it, quote unquote, frictionless and seamless? So opportunities for innovation are all around the experience. And we do that with a really clever digital front door that enhances the experience. We do it with augmented reality, which can enhance an experience. I just give you quick examples because I want to be practical, not just theoretical, but we knew that our patients in our children's hospital, it was no fun to get chemo. It's no fun as an adult to get chemo. And so we made a deal with the local zoo, and they had virtual reality capabilities. So while they're getting their chemo, they were, checking out all their favorite animals at the zoo through VR, augmented intelligence capabilities as well. So there's all sorts of ways to enhance an experience. So that's what I would really be focused on. And again, I brought up human-centered design as one component and to bring in other people, not just your techie people, but bring in marketing. And if you do have experienced professionals and human-centered design, process, all those sort of things. And of course, the patient. And Jared, I know you're a big advocate of that as well. And again, the patient centricity, the patient point of view. Never do anything. I'm big into this. It's not the single answer, but I would never do anything big without patient's presence. In fact, when I was sharing the examples about building a digital strategy together in collaboration with your peers, I always had patients front and center in that process. So those are some areas that I think are ripe for innovation.
Well, it sounds like we've got our work cut out for us.
Yeah, there's a lot of opportunity for sure.
Yeah, it really is. It's fun. This is the thing that I see us talking about, ideating on, learning as we go, but for this next phase of where healthcare is going from here. This isn't just a thing we're going to be talking about just today. It's something, I know it's something that's kind of, it's in your DNA anyway.
Yeah.
It's something that has a lot to it. So we've got to start somewhere. We've got to acknowledge the work that has to be done. And then we need to have this community around us where we are learning to ask different questions. From the marketing side, the question has been, hey, how do I manage this one platform that does this one thing?
Right.
And now we need to be, how do we manage results that are coming from these 18 different platforms that are all tied together in this way? And we understand where the data goes and stuff like that. So as I think about, kind of you just gave us a great example, and that might be the answer to this, but a tactical call to action here, one tactical step a leader on either side, on the marketing side or the IT side, can take here. What would you tell people?
Yeah, so I want to double down on my last answer based on something you said really quick, and that is the platform. So that's another opportunity for innovation. We had success with platforms in the past, ERP, bringing together supply chain, finance, and HR like 15, 25 years ago. Who won, is the platform. So, your Oracles and your SAPs. I think we need to see the same now with CRM. And EHRs, we saw that happen already 15 years ago. The platform wins. And then virtual care needs a platform. So I think those are some areas ripe for innovation. So what are some practical things to be agile? I think is going to serve everyone really well for the rest of their life. You can apply it to all of your life. Is the sense of agility, both as a practice and as a philosophy. So that is, hey, just go out and do stuff. So Jared, you can't wait for the perfect, right? The perfect is the enemy of good or something like that. Or I don't know if I'm saying it right, but I think you understand the concept where we want to wait till something's perfectly baked and then we try it, then you'll never try it. So agile is really about failing fast and putting things out there every 2 weeks, a minimally viable product. So I think adopting an agile mentality. So I literally trained my entire IT at the Cleveland Clinic, 1,100 some plus FTE, and they all became agile certified and trained. And we completely changed our org structure, the way we worked. And that made a huge difference working with marketing and others is to become agile. And then the final thing is, and I'll go back to sort of where I started, Jared, and that is you just got to be humble and listen. So I think all of us have a level of arrogance. We just don't know about it. I know I do. I think I'm aware, but I know I probably have more arrogance than I'm aware of. But I'm smart enough to know that, hey, I just need to talk to people and listen and spend time in their shoes. And so I also made all my teams, including myself, spend full days with clinicians. I volunteered with cancer patients to better understand what they were going through on a weekly basis. I served in the OR as an anesthesia tech in the early morning shifts to get a sense of what it's like to be a clinician, because I don't know, to what it's like to be a patient, because, well, unfortunately, I do know. But at the time when I started, I didn't really know. And then again, going back to your peers and understanding marketing and understanding the various departments and divisions within your organization, and just say, hey, help me learn. I've got some ideas, but they're probably not the best, but maybe together we can develop something pretty cool and really digitally disrupt our organization so that we can better take care of patients.
Mic drop. I'm just going to say that gives us our marching orders. I love it. It gives us a vision of where we should be going and how we can get started. And I love that. And before we go, tell us about Digital Voices, about your podcast, how that's been going. What's that been like?
Yeah, so we passed the test of, I think, Jared, you shared it with me. I wasn't aware of that test, but we passed it. And that's only 25% of podcasts make it to this level. And that's 10 shows and over 1,000 downloads. And there was a third criteria.
Oh, I think it was just at least one show in the last 60 days.
Yeah. So we checked. And so that made us feel good that we're on the right track. Yeah, it's digital voices. And what's different, Jared? So we didn't want to be another podcast, some CIO or chief digital officer. So what we decided was it was digital voices globally across all of the silos in healthcare. So it includes payers, providers, pharma, big tech, retail. And so it crosses the gamut of all those patients. And that's really the difference is because what happened in the past, and I don't know if it might be the same way in marketing, but in the past, the CIOs and providers, they all hung out together and they never really knew what was going on the payer side and pharma. And that's one of the reasons we're so far behind, I think, in healthcare is we've created silos and we don't cross over. That's why I love your show and talking about marketing, but not just a bunch of CMOs, but you also have healthcare IT, a whole catalog of other types of listeners. And that's what's going to help change the game is podcasts like that. So that's what Digital Voices is about. You can find us, as your local podcast repository, DGTL Voices.
Fantastic. And we're happy to say that you guys are part of the Shift.Health Content Network as well, where that's another place people can find it. And where can people pick up the book, Healthcare Digital Transformation? Yeah,
healthcaredigitaltransformation.co. .com was taken. It was going to cost an inordinate amount of money. So it's .co, but you can find it on Amazon as well. But if you want a signed copy, go to healthcaredigitaltransformation.co.
Thanks to Zane and Ed, and thank you for listening. We hope you found some value in this conversation. And if you did, please, this is so important. Would you go subscribe and tell your friends and colleagues about this podcast? Healthcare Rap is a member of the Shift.Health Content Network. If you enjoyed this podcast, you're going to love the other shows in the Shift.Health Content Network. Go check them out at Shift.Health. They're all free and available on demand. Until next time, keep marketing forward. Thanks, and that's a wrap.